Hi, and welcome to my exotic animal clinic. I'm so excited you guys came down today, and I'm glad your teachers let you get out of school. I know you're excited to be here and see all my animals, but before I start, I actually promised your teachers a little demonstration on CPR, specifically canine CPR. I'm going to tell you guys about the difference between small and large canine CPR, what CPR actually is, and how to administer it, and how to find an animal in need. All right, so we're going to start off with explaining what CPR actually is first. So CPR is cardiopulmonary resuscitation. It's an effort when an animal or a person is not breathing or there's no heartbeat. So remember, it's an actual expression between chest compressions and artificial resuscitation. So what we need to do is the difference between human CPR and canine CPR is the ratio between chest compressions and resuscitation and the additional abdominal squeeze. Now, the abdominal squeeze is actually below the diaphragm of the animal, and you actually massage it to get the blood from the lower half of the body back up to the heart. Now, before we begin, remember this is a survival tactic, so this is actually physically dangerous, and it's told if you aren't breaking ribs, you're not doing it right or deep enough. So now I will show you large canine CPR. This is my buddy, his name's Ben, and he's gonna help us learn what CPR is on the canine, even though he's a bear. So first you check if the scene is safe. If the scene isn't safe, do not administer CPR or else it will not work, and then we'll have two people in danger with no medical service, no one to call medical service, and it's basically double the trouble. So once you check if the scene is safe, then everything is okay, then you can go up to the animal and check for breathing, and you check for their pulse. Now, to find the pulse on an animal, especially a canine, is you go to the leg. So it's the back leg, and you check on the inner side of the thigh. So between where the body and the thigh meet, that's the femoral artery, and that's the best place where you can find a pulse. If there is no pulse, you move up to the breathing. If the chest isn't rising and falling, or you can't feel any breath, that means you can continue CPR. Now remember, if there is no breathing, the heart is going into cardiac arrest, which means the pulse is no longer there. So to begin CPR on a large canine is you actually bend the elbow. This is the elbow. You're going to bend it, and you're going to make it parallel to the body. So wherever the elbow meets is actually where the heart is. So you'll find the heart, and then you can start your compressions. But before that, make sure your animal is actually right side on the surface of wherever you're at, because you want the left side up because that's where the heart is. You don't want to break through too much rib to try to get to the heart. So it's easier on yourself and the animal. So before you actually begin compressions on a large canine is you actually have to do 4 quick breaths first. So when you do the quick breaths, you're actually going to take the muzzle and close it with both your hands and actually put your mouth over the nose. So, and tilt the head so the airway is open so you can go directly into the lungs. So you're going to hold it, and you're going to do 4 quick breaths. 1, 2, 3, 4. Go back, and then you can actually start your compressions on where the elbow is parallel. So one hand on top of the other. Keep your elbow straight and actually do 15 quick compressions. Now that we've done that, you actually go back up to the head and do 2 quick breaths. So same thing, make sure the jaw is closed. Put your mouth over the nose and breathe into it 2 times. Now that you've done that, we go to the abdominal squeeze. Now the abdominal squeeze is different because it's not done on humans. If whoever's CPR certified in here or knows what CPR is, it's beneficial to society because you know that you can help someone in need if you absolutely have to. But remember, it's a survival tactic. So we're going to go the abdominal squeeze, and you're actually going to put your hands right around the body like this because it's below the diaphragm. So you're actually going to apply pressure and massage to get the blood from the lower half of the body back up to the upper half of the body. So it's like a cycle. That's large canine CPR. Now we're going to get to little canine CPR. So remember, check if the scene is safe, and once you know the scene is safe, contact emergency services, go to the animal in need, make sure they're lying right side on the surface, left side up because you want the heart. But actually, that doesn't matter in little canine CPR because your whole hands are going to fit around the animal like this, and your thumbs are going to be the ones that are compression. So 1/3 to half the way down is a good compression. That counts as a 1 count. So with small canine CPR, you don't start with breaths. You just automatically start with compressions after you find the pulse and the breathing. So you go down and do it 15 times, and then you're good. And then you do 2 quick breaths. And then after your quick breaths, you do the abdominal squeeze. Everything's basically the same except for your arms are not using your palms, you're using your thumbs. So now that you know both big canine CPR and small canine CPR, I'm so glad you guys all came today and saw my little demonstration. I hope you need to use it. I hope you don't ever need to use it, but if you do, I'm glad that you guys are prepared. So thank you for coming. I'm glad you guys were so patient. Remember, this is a survival tactic. Don't use it if you find a pulse and breathing, obviously. And remember, contact emergency services. You can do this procedure for as long as you want, for however long you can, but just remember that after 10 minutes and there is no change, you can safely say that there's nothing else you can do. Now, let's get back to our tour. All right, and remember to check your bags before you leave because the lemurs are escape artists.